My name is Chris Scott. I am the Director of Clinical Education and Director of Sims Medical Center at Springfield Technical Community College in Springfield, Massachusetts. And I oversee the day-to-day running of a simulation center that's an interdisciplinary and a community college setting. And we run about 20 different programs in our School of Health and School of Nursing through it on a daily basis. And it's a center that's kept us busy learning a lot about interdisciplinary education and patient simulation. Our center at Springfield Technical Community College is referred to as Sims Medical Center. It started in 1998 with 2 patient simulators and interest from nursing and respiratory therapy to get involved in patient simulation. And Dean Foss, who's our leader of the program, really wanted to focus on building more interdisciplinary learning, not only having individual programs use the simulation center, but also getting more involvement of other programs involved in working together, really trying to build what we are trying to do in healthcare and merge different programs together to allow for learning of what each other does and be able to communicate effectively and work with others. And so we've now grown to over 20 different patient simulation areas and 32 high-fidelity simulators that allows us to capture 20 different programs, from occupational therapy to physical therapy to nursing to medical assistant and multiple others, and also work to pull them together to work together, and that's really where we've had a lot of success. I believe that we really did, as far as coming in on the early side of simulation adoption. It was important to the founding people in our institution of the program, and we started off, as we said, with 2 patients, and really now today built it into a true medical center where we have the opportunity to have interdisciplinary learning occur and allow for a transfer of patient, including, for instance, a nursing care going on and calling respiratory therapy in, and maybe transferring from one of our trauma areas a patient to an ICU, or transferring them to radiology, and the communication skills as well as the teamwork that's required to have those different events occur or experiences. I think it's an interesting thing. It's something that we are still moving into too. We recently have a sim mom, and we built a family life center where we use sim mom, sim junior, sim baby, and sim newbie, and really trying to allow for a growth. It's an area where we needed to grow and gain more experiences, and so today's session really helped apply and drove the point home for us. So what I'm speaking to is capturing simulations for better debriefings. And what we're really trying to focus in on there is trying to help participants that come to the SUN see what opportunities are out there to help to better capture them, so that when they go into the post-simulation experience piece where they have to cause a debriefing to occur and interact with the students, do they have the proper ability to capture the areas that they needed to, from camera angles to the type of equipment to microphone, and trying to lay a good foundation in experiences and ideas that we've had from trying to capture better simulations. And so we try to share some of that, and that's really today why they had us here, to try to explain a little of our history and track record, to try to give the other participants an opportunity to grow. I think it's been a wonderful experience. I think they've done a great job in delivering a wide variety of topics, and the tracks have been, I think, very successful in trying to meet each person's needs, trying to find where their areas where they want to be. And from talking to a lot of the participants here, they've been pretty excited to be able to find their area that they really wanted to learn and gain knowledge on.